Hi, this is Dr. Linda Kiley, the Holistic Urogynecologist, and today we're going to talk about how to relax the muscles in the pelvis. So I want to emphasize that this should not take the place of a consultation with a pelvic physical therapist. The problem is that I know there are a lot of women who don't have access to a pelvic therapist either because of distance or because of cost, insurance coverage, what have you. So I still encourage you very strongly to get a consultation with a pelvic therapist if you are having problems with urinary frequency and urgency, pain with intercourse, constipation. Those are all things that can be addressed properly with a well-trained pelvic therapist. However, since I know that this can be difficult, I want to give you a few things that you may be able to do at home that will hopefully help you to relieve some of these symptoms. So we're going to start with a few things illustrated while you're on the bed, because I have a lot of patients who have trouble getting up and down off the floor, and I've seen many videos that show doing these exercises on the floor. And actually, when I've told patients you need to do pelvic floor therapy, they actually think it means they have to get down on the floor to do it, and that's not the case at all. So typically in the office of a pelvic therapist, you'll be on a special table that is designed to help work with you on improving the function of your pelvic muscles. But I will be doing this on the bed because when you're at home, you're probably going to do it on your bed as well. So we're going to start first with just a few simple things. I'm going to lay down and illustrate the proper technique for diaphragmatic breathing. So one of the things that is very important to learn how to do properly is breathe. And while we all breathe on a continuous basis, generally without thinking about it, a lot of times when we're thinking about breathing, we actually do a lot of chest breathing. So I'm going to show you what a chest breath is like. That's when you take a breath and your chest rises up and falls. So that's not what we want to do here. We actually want to breathe with our diaphragm. So the diaphragm is a big muscle under the rib cage, and when we take a deep breath in using the diaphragm expands down into the abdomen, and it causes the abdomen to rise and the lower body to expand. So I'm going to show that to you right now. Taking in a deep breath with my diaphragm. You can see that my hand raises up off with my stomach, so my stomach gets bigger. And then when I breathe out, my hand falls again. So again. So that's a diaphragmatic breath. And at the same time, when we're doing this, what should be happening is our pelvic muscles should be relaxing. Now, sometimes when I have a patient do this in the office, she'll actually tighten her pelvic muscles, and that's a problem. And a lot of times that happens out of fear that if you relax your pelvic muscles, that you're going to lose urine or stool, or something else is going to happen. So it's very important to be aware of your pelvic muscles. And as you're breathing and taking that deep diaphragmatic breath, that abdominal breath, that the pelvic floor also descends a little bit and relaxes. So this is all about relaxation. So again, a deep breath in and out. So the next thing that we can do is just do a few easy stretches. So that also should involve relaxing the muscles in the pelvis, but stretching them helps them to work better. Just like any exercise, running or weightlifting, it's important to stretch your muscles out before and after. It's also very important to make sure that your pelvic floor muscles, all of your pelvic muscles, get a chance to be stretched as well. So we're going to start with a simple one, bending the knee and grabbing the knee and bringing it in towards the chest. And we should do that just by using our arms, or if need be, a strap. If you have trouble doing it with your arms, You can get a strap and just put that around your knee and hold it. It shouldn't be painful. None of these exercises should be painful at all. So you should at most feel a little gentle stretching, but really it should kind of feel good. You should feel a little release. So you can let that leg go out a little ways. You can rest it on a pillow if you like. And then you can also bring it into the other side. So if we kind of let our legs fall to the side, that helps to stretch out the muscle called the piriformis. That's a butt muscle right here and is often involved in sciatica when it's too tight. When that muscle goes into spasm, that big sciatic nerve that goes down the leg that you can get all that back and leg pain from gets compressed. So stretching out the piriformis muscle can be very helpful in improving the other muscles in the pelvic floor. So we do that, and always remember, do both sides. So I'm really just doing one side, but we can do both sides. And again, diaphragmatic breathing. You take a deep breath in and out when you do this exercise. All right, so we're going to move back to the center, and the next thing we can do is both legs at the same time. So you can either do this with your hands, pulling your knees up towards your chest, and again, breathing in and out, diaphragmatic breath. And you can let your legs fall out a little ways. You can rest them on pillows. I've done that just to help with relaxation, because the key here is we don't want these muscles to be tight and tense. We want them to be relaxed and stretch a little bit. So you only go as far as you could go comfortably, and if that means that you need to rest them on pillows, you can do that. I'll just show you real quickly. I'll put a pillow here for my left leg and just let it fall out. All right, so that's another one of the nice stretchers that we can do. The other thing is a pelvic tilt. So a pelvic tilt involves just putting your feet flat with your knees bent and just rocking your pelvis forward, pointing your pubic bone up towards the ceiling. You don't have to do this really hard. You don't have to be real tight with it. Just a gentle rock upwards. And again, a deep diaphragmatic breath. Make sure those muscles are nice and relaxed in your pelvis when you do that. And then release. So all of these exercises can be repeated 5 to 10 times. And the more you do them, the more repetitions you can do. I also recommend that you try doing a few in the morning and a few at night when you first wake up and when you go to bed. The last one I'm going to show you here is the leg off of the bed pose. So that involves just letting your leg dangle off the side of the bed. Now, if you have trouble bringing your leg back up, if that muscle isn't strong, you can use a strap to help you. So let your leg dangle off the side of the bed and just relax. Again, diaphragmatic breathing. And just let it rest there. And when you're done, just bring your leg back up onto the bed and do the other side. Just remember to do the other side. So that means you're going to scoot over to the other side of the bed for the exercise. So these are just basic beginning exercises that you can do to help with releasing some of the tension in the pelvic floor muscles. That's a very important thing to do. Kegel exercises are often recommended and they can be helpful, but there are some problems with Kegel exercises. First of all, they're often not done properly, so if you don't know how to do one properly, that can be a problem. And second of all, if you have a highly tense pelvic floor or highly tense pelvic muscles, the last thing you want to do is squeeze those muscles. So again, it's really important to get the proper advice and training from a pelvic therapist. If you can't do that, I really recommend that you see a urogynecologist and find a way to get those muscles treated properly, because that can make all the difference in how your bladder functions, how your bowel functions, whether or not you're able to do some really basic activities, hold your bladder when you need to, and how many times you have to get up at night. It can depend very much on whether or not you're able to relax your pelvic muscles. So for next time, we'll go over a few other things that we can do, but for now, this is Dr. Linda Kiley, the Holistic Urogynecologist, signing off. Thanks.